Hello all, my name is Kayleigh Barnett, and this is my presentation titled, Are Agricultural and Farm Youth Leaders Prepared to Talk About Suicide? These are results from an Illinois needs assessment. I'm going to go ahead and turn my camera off so that way this presentation will run a little more smoothly with internet connection and be more stable. And we can go ahead and begin. So, as you might know, poor youth mental health is a growing public health concern. Specifically, older children and teens are at risk of suicide and depression. Farm and agricultural youth are a vulnerable demographic as they experience unique stressors from working and living on family farms and ranches. We believe that youth leaders play an instrumental role in identifying mental health needs as they routinely work with farm and agricultural youth. As such, we were motivated to understand their perspectives and experiences. Using the health belief model pictured here, this study aimed to identify agricultural youth leaders' self-efficacy, barriers, and opportunities for mental health conversations, perceptions of the severity and susceptibility of ag youth mental health, and their training and resource preferences. We developed a 20-minute survey using Qualtrics and distributed the links to Illinois agricultural and farm youth leaders through Agriculture Educator, 4-H, and FFA listservs. Data was collected online from March to May 2022, and 2 email reminders were sent out to increase response rate. A raffle was organized, and winners were randomly picked as an incentive. 74.8% of respondents identified as women and 87.1% of participants classified themselves as white. 86% of the survey pool reported receiving a bachelor's degree or higher. 30.4% of respondents identified as 4-H and extension professionals, while 65.2% were employed as FFA advisors and agricultural educators. Additionally, 50.2% of participants reported receiving professional mental health training. A list of 18 mental health topics were presented to participants, and they were asked to report the frequency of conversations they have for each topic with agricultural and farm youth. Presented here are 3 acknowledged mental illnesses: anxiety, depression, and suicide. As you can see, 85.7% of agricultural and farm youth leaders report never or yearly talking about suicide or suicidal thoughts with agriculture and farm youth. We completed a non-parametric chi-square test for independence to better understand agricultural and farm youth leader communication behaviors. We discovered statistically significant relationships between frequency of conversation and the items barriers and self-efficacy of the health belief model. At P equals 0.003, appropriateness was a barrier to discussing suicide with agricultural and farm youth. Specifically, a significant association was shown between the number of respondents that selected, "I do not think it is appropriate that I discuss these topics with the youth I interact with," as a barrier, and their frequency of conversations about suicide, reporting less conversations. Interestingly, though, time and resource availability were not shown to be statistically significant barriers. Self-efficacy was also an inhibiting factor for facilitating conversations with agricultural and farm youth about suicide. At P equals 0.017, respondents who selected not having the confidence to discuss suicide had a higher association of less frequent conversations about suicide. At P equals 0.005, there was an association between the respondents who selected they did not have enough knowledge to discuss suicides with their conversations about suicide, making them less frequent. To wrap up, suicide is a growing population health concern, but agricultural and farm youth leaders do not discuss suicide with youth. Appropriateness, confidence, and knowledge are behavior impacting factors. A lack of self-efficacy and social disapproval limit conversations centered around suicide. We recommend that further research, interviews, and focus groups with agricultural and farm youth leaders to better understand what they need to facilitate conversations about suicide with youth. Thank you so much. My contact information is here. Please feel free to reach out to me if you have any questions.